every day and in every way. Enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Oral cancer, also known as mouth cancer or cancer of the oral cavity, is a type of cancer that originates in the mouth or throat. It often is characterized by the growth of abnormal cells in the lips, tongue, cheeks, gums, roof of the mouth, tonsils, or salivary glands. Early detection and treatment is crucial as oral cancer can spread if left untreated. Now here is the one I want each and every one of us to hear. In 2025 alone, the prevalence of oral cancer in Nigeria is estimated to be 20%. Tell me, how did we get here? Listen, you'll find out some of the things that are bringing about oral cancer and making it more prevalent now. This suggests that approximately 1 in 5 individuals, so if you are together, 5 of you, 1 of you in Nigeria may be affected by oral cancer. So what are these things that can easily bring about it? Habits such as tobacco use, so those of you that are smoking, alcohol consumption, those of you that are drinking, and now this is the very last one that some of you think you can escape. Oral sex. These are the 3 major factors. So the plate lickers and the mic grabbers, you are more at risk of having oral cancer. But again, this is the physicians. So we'll be discussing oral cancer with our expert on your favorite health TV talk show, the physicians. We'll be right back after this short break. Do stay tuned.
Every day and in every way. Enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
It's another beautiful day on your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Memuna Yusuf Kadri, and today we are going to discuss something very important, a topic that each and every one of us need to hear. So if you are alone, this is the time for you to call down your friend, tell them to join DSTV or GoTV or Star Times, that the physicians is about to start and we are discussing oral cancer. If you have family, please bring them along because this is a family show and we are here to educate, reduce misinformation, and of course enlighten the general public. And with me to discuss this amazing topic is one delightful, amiable dentist. She's no other person than Dr. Mercy Elijah of the Perisource Dental Services. Dr. Mercy,
yes, ma'am. Thank you so much, and you look amazing, ma'am.
This is a topic that everybody has been waiting for, so they are waiting for you. And I know that you are going to break it down because we are talking about oral cancer. So before we even go into all the nitty-gritty of what are the risk factors, the causes, the symptoms, what is it about oral cancer that we should be more intrigued about?
Okay, so when we talk about oral cancer or cancer generally, we are looking at the cells of the body. They are growing abnormally, right? Things are supposed to be normal, they're becoming abnormal because of some factors. That is what cancer is generally. So about oral cancer is when the cells of your mouth have become, instead of normal, they become abnormal due to certain factors. And one thing you should be intrigued about oral cancer is the fact that it is very common among young people currently.
Young people
currently.
definition?
We are looking at 35 and below. Before, it used to be 45 and above, but in recent times, we are seeing it more in 35 and below.
So that takes us to the risk factors. So who are those more at risk of having oral cancer?
Okay, so those at risk are, I'll start from the beginning. Before, it used to be 45 and above, those who smoke a lot, chronic smokers, those who drink alcohol a lot, and then for those who do both of them. So if you drink, you are at risk about 60%. If you smoke, about 60%. But if you smoke and drink, you have over 65% chance of coming down with oral cancer.
Oh, wow.
Yes, that is it. And then another, now when I'm talking about the younger population below 35 years, we're looking at human papillomavirus. Now, when you hear HPV or human papillomavirus, you think of cervical cancer in women. Exactly, or any cancer around the genital region. But now these cancers have found themselves in the throat because of some practices that a lot of younger population are involved in, and that is oral sex. So
that is why the younger population. So you said the older population are not, they follow come.
Oh, well.
They don't understand.
Well, a lot of them. This thing is more rampant in the younger population currently, and we have more data on them than the older population because most of them don't even agree they have sex anyways.
Yes.
Yeah,
the same thing with older age.
Exactly.
So the younger people, so you're talking about the plate washers, the mic grabbers. Yes. They should be careful.
They should be careful. And another thing, again, in northern part of Nigeria, it has been known that too much kola nuts can also lead to oral cancer. There are studies on this.
Kola nuts?
Excessive use of kola nut in northern Nigeria, most especially.
So those people that take kola nut to prevent sleep should also be careful?
They should also be careful.
Is there a gender difference between male and female when it comes to oral cancer?
Yes, there is. More male. From research, we have more oral cancer affecting more men than women. And that is because of the smoking and the drinking factor.
Exactly.
Oh.
Not on the other side of it.
No, not on
the other side. So more drinking and so what are these symptoms that likely somebody has cancer, oral cancer, what do they present with?
Okay, the first thing is unhealing ulcer. Maybe there's an ulcer or a wound or a sore in the mouth, in the tongue, and you just discover that it's not going anywhere. You've tried, you've taken medications, and they're usually not painful. So you don't even know you have it in the first place. Some people don't even know they have it. They've forgotten about it, but it is there. Another thing is whitish or reddish patch in the mouth, any part of the mouth. It is whitish or it is reddish. Some people try to scrub it off with their toothbrush, but it's not going anywhere. That is a sign. Then another thing would be difficulty swallowing food. You're having problems. It's not sore throat. You just have this difficulty swallowing food and all of that. Yes, those are the major.
Those are those are things that people may just overlook and just, oh, it's just one of those things.
Exactly. And then also one more thing. Your mouth or your teeth start shaking, and then some of them start falling off randomly. For no just cause. And you don't have diabetes, you don't have any gum diseases, but your mouth is just shaking. And also swelling as well. You have swelling in any part of the mouth. It is also a sign of oral cancer.
Are there some myths that comes with oral cancer that we need to bust?
Because oral cancer is not, will I say the awareness is not that rampant currently, so we don't really have a lot of myths about them. Yes.
So, you know, in Nigeria, when you have this mouth sore, I need you to talk about that, because a lot of people have some, you know, their own version of what it is. So please, can you educate our, the general public, because this is a family show.
Okay, so when we talk about mouth sores, there are different types, but the one people talk about is they think it's a sign of malaria.
Exactly.
It'll be like, oh, malaria, but it's actually herpes. Yes, herpes is a virus that affects people, and when you have it, it's like, they call it a gift that keep on giving. I mean, it comes when your immune system is down, and that's why a lot of people think it's malaria. And it's actually a sexually transmitted infection, or children can get it from being kissed when they were little, and it hides somewhere in the body and it manifests whenever the immune system is low. And adults can get it from kissing and from doing other things. So it's herpes.
So it's not malaria?
It's not malaria.
Nigerians, it is not malaria.
It is not malaria.
Please, come closer. Let's have August meeting.
You don't have malaria.
It is not malaria. It is herpes, and it is viral.
Yeah.
And it can come from many things, apart from low immunity.
Yes.
That's that sounds quite, being a doctor, but a lot of times people tend to rub it and say it is malaria, it is this, it is that. So now we talked about the risk factors, we talked about the symptoms. What are those very cogent signs that, as a doctor, what do you get to see? Because like you said, it's not so common.
Yes.
So people don't get to come present with it. So what are those things apart from the reddish or whitish patch doesn't go away that you get to see that you say, okay, this is it, that is oral cancer that you...
Okay, so the mouth is, I always say the mouth is the gateway to the body, and you need to protect it at all costs. So imagine leaving your gates unguarded. There's going to be a lot of problems. And there are so many things that can happen. So you having a reddish patch or a whitish patch, there are other things that can lead to that. But when it becomes persistent, when it's maybe taking up to a month, 2 months, it's not going away, then you can say, okay, this is cancer of the mouth. Or there are tests that need to be done. We have some tests in our clinics where we just put it in your mouth and look under the lights and say that, okay, fine, this is a pointer to oral cancer. Yes.
So there is kind of a specific test that you can say, with this test, it is oral cancer or nothing?
Okay, the tests are usually, let's say, biopsies. Yes, you have to take a sample of it and take it to the lab to be able to see, okay, this is oral cancer and this is the type of oral cancer we're looking at.
How deadly is oral cancer?
Cancer generally is deadly. We all know that. So oral cancer is deadlier. And it is deadlier because when people are not aware. Sometimes it is too late. They don't even know they have it. Yes, so oral cancer is very deadly. Yeah, that's what I would say. It is very deadly. Very dangerous.
Oral cancer is very deadly, is dangerous, is not easily detected.
Exactly.
People don't even present with it on time.
On time, yeah.
And so when they present with it, it's usually
late stage.
Late stage. Maybe it has even spread to other parts of the body.
Yes.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Okay. But you made mention that the younger age group, 35 years and below, they are now more at risk of oral sex because of oral cancer, because of oral sex. Is it the oral sex practices? What is it about oral sex that's making them more at risk of oral cancer?
Okay, so oral sex, getting oral cancer from oral sex is HPV related. So it is called HPV related oral cancer. We all know that, or a lot of people know that HPV is cancer of the genital. It causes cervical cancer in women. But due to oral sexual practices, people are taking their mouth to the genitals. So if someone has HPV, which is a human papilloma virus, and you take your mouth down there, you are invariably getting the HPV into your throat.
Straight up.
Exactly, and that is how HPV-related oral cancer comes about. And we know that oral sexual practices is rampant among the younger generation. Well, older generation, but more among the younger generation, and that is where oral cancer comes from at this point.
Wow.
Yes.
So, will it be better if we preach hygiene or total abstinence?
Okay, well, I would not say hygiene is very important, we know that, but hygiene is not how you get HPV. HPV is a sexually transmitted infection, a viral infection. So if you have sex with someone or body fluid and all of that with somebody that has HPV, you get it. And then somebody else comes, put their mouth there, you get it to your mouth, and then you end up getting oral cancer. So hygiene is important, and then screening is also very important, especially for women. When we talk about something like pap smear, yeah. So if as a woman you go and have a pap smear done, then you can also do an oral swab. Okay, so they will take a piece of cotton wool, swab your throat, put it under the microscope to check if you have HPV in your throat or in your mouth. Yes, that is it. And for the ladies, HPV vaccine is also very important. That will also protect you from HPV-related oral cancer. So when you get your HPV vaccine, it's more like you are killing two birds with one stone. You are trying to prevent cervical cancer, and then you're also preventing oral cancer. But problem is Nigeria, the HPV vaccine is for girls 14 years and below. It's free. I am advocating that it should be for boys and girls because boys are more, they have more prevalence of oral cancer in male than female currently.
I learned the boys to come soon because they wanted to start with the girls and later with the boys and all that. So I'm sure that one will cover it. But for us that are adults, when you do your pap smear, the honors lies on you to make sure that you take your vaccine. To make sure that it covers that. So now we have talked about symptoms, risk factors, presentation, even investigations. How do we manage oral cancer?
Okay, so for me, management starts with prevention. Prevention is better than cure. We all know that. So first of all, a lot of people, we look at the mirror every day, but we don't get to even look into our own mouth. How many of us have opened our mouth to check how our mouth look like? Yes, like just look at your mouth, take a mirror and look. It is called oral self-examination. Yeah, it's just like breast self-examination where you examine your breast. So you open your mouth, look at your upper lip, your lower lip, your cheeks, your tongue. You're checking for redness, you're checking for swellings, you're checking for pain or anything at all. So it is good for you to at least do it, even if it is once or twice a week. Open your mouth is very important. Look at it properly. That is very important. And then another thing you can do is proper oral hygiene is also important. And I want to mention something that a lot of people have tooth decay in their mouth and they have not done anything about it. They've abandoned the part of their mouth. Yes, they've abandoned a whole part of their mouth because it hurts instead of going to see the dentist. So one thing that can also predispose to oral cancer, which I did not mention, is when you have persistent toothache or a toothache or when you have tooth decay that is not taken care of. Yes, that is one thing because you're disrupting the cells over and over again and it might lead to cancer of the mouth. So it is very important, oral hygiene. Visit your dentist 2 times in a year. Yeah, very important. Check your mouth. And again, if at any point you've been diagnosed with oral cancer, it is not a death sentence. No, it's not. It can be managed. So if it's something that has to do with the swelling, then surgeries can be done. There's chemotherapy, there is radiotherapy, there are medications. Yes.
What are complications that can arise from this?
Okay, complications of oral cancer would be, first of all, it can spread to other parts of the body. That is metastasis, and it is very common. One of the commonest sites it spreads to is the lungs, then the breast for women and men as well. And then it can also move up to the brain, to the eyes. Wow. Yes, so one of those complications is metastasis. Another thing is the fact that for cancer of the tongue, they might take out part of your tongue, and that can affect your speech, the way you talk. Then also for the jaw bones, they can take out your entire jawbone and you have nothing there. Then they have to like put a plate in there.
Yeah, like prosthesis.
Exactly,
right?
prosthesis. And then you have cost. These things are very expensive, from the treatment to the surgeries and then to the restoration, because you need to get implants at the end of the day because you need to have your smile, your teeth to function. So cost, very expensive.
What's the role of family in managing oral cancer?
Yeah, family is very important because you need a lot of support as possible. You need people to run around for you. You need family members to be there for you, to love you, to care for you, because mental health, it can also affect your mental health, which is something I wanted to mention. Yes, mental health, because it eats away most parts of your life. You spend a lot of time in the hospital, you're spending a lot of money, so it's affecting you. You are not productive as a human being, and everything as humans, we all want to be productive, so it eats away at your mental health, and you need family around. You need to also visit the therapist after the whole thing is done. So family is important.
Last word for our viewers. Somebody has just walked in now and is just listening to you and we're talking about oral cancer. Please speak to that one person. What should they do in prevention before even getting into treatment?
Okay.
Tips they should take away.
Okay. Takeaway tips would be, you need to check your mouth. Oral self-examination is important because oral cancer is not painful. People go to the hospital because there is pain. If you don't have pain, you don't care, there is something there. So early detection is very important, and that is oral self-examination. You also need to brush twice daily. You need to visit your dentist twice in a year and get vaccinated. The HPV vaccine is very important.
She has said it all. She has wrapped it up. Get vaccinated, do oral self-examination, visit your dentist. Don't make it look as if it is too much for you. And please, for those of you that believe that you must use a very strong, hard toothbrush to brush your sins away, that the devil has struck and village people are after you, she has said, look, get me. You don't need a hard brush. You don't need a brush that's not too soft, not too hard. There's always that medium. It's even written there to brush twice daily, also floss as much as possible. She specifically mentioned that prevention is better than cure, because oral cancer do not present with pain. And for those that are practicing oral sex, please, the HPV virus is down there. So when you are putting your mouth down there, be careful, because once you take it in, it's going straight into your system. So please know who you are doing it with, know where you are doing it, and have sense while doing it. My name is Dr. Memuna Yusuf Kadri. Be kind to follow us on all our various social media platforms. And if you want to be like Dr. Mercy Elijah here, go to our website, thephysiciansng.com, fill the form, and please come talk to others. Share from your wealth of knowledge. We are immensely grateful for everyone that has been following us, and you can binge on all our episodes, over 300 episodes on our YouTube page. Until next time, remain blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.